Morning all. Going to sit on a dumbbell here. Today I'd just like to talk to you about something that we all face. And if you're pushing yourself in the gym, if you're trying to get stronger, continually turning up for yourself, being persistent in your training, what is going to happen eventually is you will get some sort of niggle or injury. Now, that is in fact completely normal, because if you're pushing your boundaries and always trying your best to get that little bit better each day, sometimes we overdo it. Sometimes our movement patterns aren't quite on point and we get a little niggle. We might get a sore hip, we might get a sore back, a sore knee, a sore shoulder. So what I want to share with you today is where I'm at with my shoulder. Now, bear in mind, I've been doing Olympic weightlifting and powerlifting for 14 years. Of course, that's going to create a little bit of wear and tear in the shoulders, especially because I'm doing so much overhead movement. I'm doing external rotation at speed. I'm doing bench press heavy. So there's a lot of load going into the tendons in the shoulders. Now, although I do my best to do lots of prehab work, so strengthening the tendons, mobility work, there happens to be times when I push myself and overextend. So about 6 weeks ago, my latest shoulder story, I'm going to call this a story, was I turned up to gym one Saturday morning and thought, no one was here, and I thought, you know what, I'm just going to try some heavy close grip bench press. I'd previously been doing bench press for a powerlifting competition, so I thought my shoulders were ready to go. It's not a new movement. I haven't suddenly introduced a movement I haven't done for ages. So I did a heavy set of close grip 5 RM bench press, and that was all fine. It was very heavy, mind you. I walked away from that, was fine. That night, I couldn't move my arm that way. I couldn't lift my arm that way. And I thought, I may have done some damage here. So over the next few weeks, it got a little bit better with some extra retraction work and a little bit of rehab. So then I went straight back into Olympic weightlifting and found that every time I went overhead, it got just as sore. So what was happening here was that I was in a injure, re-injure cycle. So I was injured, it felt a little bit better, so I went back to what I was doing before the joint or tendon or muscle is ready, and I was re-injuring it. So after about 6 weeks of going through this pattern, I took a step back, looked at the big picture and thought, do I want healthy shoulders as I age? Or do I want to end up at the other end of the scale on the operating table? Or even possibly with frozen shoulder. So my brain kicked in. Instead of my heart, I listened to my brain and thought, now's the time to stop, go back, really assess the shoulder properly, go and get some advice, because this is not this. If you have a shared journey in your strength journey, in your fitness journey, it makes it so much more, number one, effective, and number two, enjoyable, because you know you're not in this alone. It then becomes a shared journey, okay? So I went to a couple of good physios, I went to a sports doctor, I found an awesome shoulder program, which I am going to make videos for you guys very soon. And so you guys, anyone experiencing any type of shoulder issue can go through this shoulder program, which builds from the foundations up, and it is specifically designed for anyone that wants to go overhead, even if all you're doing overhead is pressing. So the reason I made this video is to encourage you, if you have some niggle or an injury, to reach out, get some help, and know that it is a current injury that you're dealing with, and you will get better if you listen to your body, use your mind, and work smarter, not necessarily harder. Have a great day, and I'll keep you informed on my shoulder journey.